Assalamualaikum everyone. There was a small request from the in-house GTT doctor regarding the basic setup for endo treatment. What are the armentarium required for the endo treatment? So he asked me personally. So I thought, okay, I had a case today. So before I start the treatment, I thought let me show the small setup what I have and basic instruments required. What all is assorted in the trolley and what all is organized here. In the phone. Yeah, now starting from the left side, these are the basic files. I think all the practitioners in-house, all the clinicians house have this. These are K files. Endo block, endo block is basically to keep the files and the scale here to measure. I seldom use this because I have this unit. I'll come back to this. Okay, so Dispo van. This is the Edta Gel. This also I seldom use unless until we have a curved canal or very thin canal or sclerosed canals. Only then I try to use this. Normal saline, which is loaded here. Sodium hypochlorite 5%. The needle, what is shown here is side vented. Sorry, I'm not able to focus. Yeah, I think I had given a detailed explanation of different needles used in endodontics. That video can be seen on the GDP YouTube channel. So this is a double side vented needle what I have here. And then we have a condenser. We have a plugger basically. Filling instrument, tweezer, a DG16 probe and a good mouth mirror. These two are the your primary equipment. It is basically your stethoscope of endodontics. A good mirror, a good vision is an added advantage in your field of view to appreciate the anatomy of the tooth. Then I have a box here. This box is basically comprising of different rotary files. Rotary files of different companies. I don't remember what all companies here. So there's something from I think there's an M2 file. Yeah, so I have files arranged from lesser taper to greater taper, 4% and 6%, 20, 25, 30 that way. And this section is for the path files, this one. So separate box, separate section for the path files. Then I have an access openers kept in this section. It's easy to just pick it up because if your access opener is kept somewhere, you have to keep searching. So it's easy to just pick it up. Even the files, I think not all the files are arranged properly here. Few of the files I see 6% files, 4% files have gone back. So end of the day, where you arrange, how you arrange is up to you. How you pick up the files at your ease, at your speed. So this is the rotary files. And coming back to the apex locator here, this is the lip clip. Apex locator from J. Morita. I think J. Morita is quite a gold standard in the use of in the categories of apex locator. Gold standard like how hypo. I think J. Morita is accuracy readings are quite accurate compared to the other apex locators in market. Other doctors who are using other apex locators can give their personal feedback on the group, inshallah. And this is the various attachments for the apex locator. This is the file holder. This is the lip clip which goes onto the patient's mouth. Then rubber dam sheet, latex rubber dam sheet, rubber dam clamp holder for forceps. This clamp is a butterfly clamp for the anterior which I am about to start the treatment. This is the liquid dam, a gingival barrier to seal all the margins to prevent to prevent leakage of the hypochlorite solution. My bad, I use the word micro leakages. Okay. Then the other trolley has an endomotor from Xmart. This has been a workhorse in my clinic from almost 10 to 12 years. Superb instrument. This is the corded one. You have cordless Xmart now. That is also quite good, but my personal choice is always with the cord. It doesn't get spoiled actually. The cordless one, battery issues, and when you hold it in your hand, the back portion of the apex locator, your endomotor, it's quite heavy. So when you hold this, it's very light. That's personal choice. Then we have the sonic irrigation device. Then for that the attachments are of different sizes, 20, 25, 30, depending upon the size of preparation. Then we have this unit called as warm vertical compaction unit. This is the down pack unit. To keep it simple, basic GP cutter. And then we have the backfill unit. Backfill unit is to the moment you sear the GP at the middle third, or wherever you want to sear the GP, the amount of space left can be filled with this unit. The small opening what you see is to put those GP pellets. They come as preformed pellets in these sizes. It's like small bullets, like cartridges. You just need to remove that, pull the plunger back, keep it and push it back. What was next? Yeah. To the down pack, we have different kind of those tips available. There's an 8% tip, a 6% tip, the size 0.5 mm, 0.7 mm, depending upon your choice. This is the most common simple setup everybody can have at their practices. It is not a very costly setup, very simple setup. I reckon all the doctors to switch on to rubber dam. Life is much easy with rubber dam. Work is much easy with rubber dam. Isolation at its best. I know people are doing very good endodontics without rubber dam. I used to do. I myself, I was a non-rubber dam user once upon a time. Thanks to all the doctors who have really motivated me to do better endodontics. And to summarize, with all these instruments, I think the main gadget what I really rely upon is the loops what I have. So these are my magnifying loops, TTL loops, 3x loops. So these loops can be of different magnification, 2.5, 3, 3.5, can go up to big numbers. So for an ideal loop magnification for endodontics is anywhere between 3 to 4.5. Good magnification. I prefer TTL over flip-ups because TTL is very on the weight issues. The TTL are quite less weight compared to the flip-ups. Whatever shown here is for the as an added benefit to the doctors who really want to do a better endodontics. Please feel free to ask any queries, any questions to me or any of the endo team present on the group. Inshallah, they will help you. And if you want to get into the steps of starting good endo and what you need to purchase, what exactly you need, you can always take the help of people who are using rubber dams, different type of clamps, what exactly you want in your practices. You don't have to just go and invest on huge amounts. Jazakallah khair. I have a patient waiting. Any queries? Please feel free to ask. Jazakallah khair. Thank you.